Hi everyone, my name is Tierney King, Associate Editor of Medical Design Technology, and I'd like to welcome everyone to today's webinar brought to you by Keyfactor. The presentation today is called Life Critical Secure Identity, Medical Device Manufacturers are Leading the Way in Cybersecurity. Today's proliferation of connected medical devices, both currently in use and under design, is unprecedented. The global IoT market is expected to grow nearly 30% annually, reaching $322 billion by 2025. This velocity is challenging medical device manufacturers to compete harder to be first and best to market. As innovation accelerates, it's imperative to keep one of the most important considerations with lasting consequences top of mind: device security. In today's webinar, Tom Klein, VP of IoT at Keyfactor, will share his insights on how MDMs are meeting these challenges head-on. You'll learn more about how to future-proof your product lines with cryptographic agility, comply with FDA cybersecurity guidance and regulatory requirements, and optimize device rollouts and lifecycle management. While you're listening to the presentation today, I would like to encourage everyone to submit questions at any time by typing into the designated comment section on your screen. Following the presentation, we'll have a question and answer segment where today's speaker will answer individual questions submitted by members of the audience. Remember that today's webinar will also be available on demand, so you can view it again at your convenience or share it with friends and colleagues. You will receive an email with a link to access the webinar within the next few days. Now I would like to welcome today's speaker. Tom Klein is the Vice President of Sales with a focus on driving Internet of Things security-related revenue and processes. Tom is responsible for the execution of Keyfactor's revenue goals and identifying key new market opportunities that increase market share within the secure identity and access segment. He brings over 38 years of experience with client-facing leadership roles for Fortune 1000 clients at IBM, Microsoft, as well as startup firms. He has played a significant role in product launches and one-to-many marketing campaigns. I will now turn it over to our speaker for the presentation. Enjoy the webinar, everyone.
Good morning or good afternoon, everyone, wherever you may be, and thank you very much, Tierney. That was a nice introduction. I appreciate everyone spending a little bit of their time today with us. Hopefully, we will provide some insights, maybe a little bit of perspective or education, and certainly a view into many of the things that are going on today. I've gone through this presentation and talked to many firms, many in the medical industry, but also transportation and automotive and a number of different places. And I've come up with this life critical secure identity title mainly because as we look across the industry today and see all of the individual organizations and devices that are coming online, what we're seeing is that the true investment and the types of things that are getting attention are those things that, quite honestly, are life critical. So as you see autonomous vehicles, as you see things in the medical device manufacturing area, whether they be devices in an operating room or things that you take with you with medical care at home and a number of other things. You look at elevator systems, transportation systems, things that will have a really bad outcome for the individual are things that are getting a lot of investment and attention now. And that is one of the reasons why I think, based on some of the organizations that I work with and the industry itself, that I think that the medical device manufacturers are kind of leading the way in this. They are recognizing the importance of what they provide, but they also recognize the liabilities or the challenges with that in today's market. So that's kind of why we're going to talk about it in that vein, but this really does apply across industry from a security standpoint. So I think we all know about the proliferation of connected medical devices. If you look at, or if you've been in a hospital room, you will see a number of different things that you're wired up to, whether you are in there in intensive care where there's just a bunch of them, or post-operative, or if you simply are in for a procedure and need an infusion pump or a little blood pressure monitor. Everything is connected, and because things get connected, there certainly is a risk that gets elevated from bad actors and other situations that you want to really try to mitigate. If you look at the industry as a whole, you'll see that in Internet of Medical Things, which is kind of where we're going to focus the majority of this talk, the explosion in spending is tenfold easily over the next 9 years, and everything that is being produced today, and all of or many of the services and therapies that are being driven out are being done so through a more connected world. I think that also there has been a pretty good effort in terms of regulations and guidelines to try and pull some things into control and to make sure that organizations are being as responsible as possible to their constituents, which are in most cases patients and in some cases caregivers. The velocity of change is remarkable. What we're seeing today is light years ahead of 2 years ago, and just in the last 6 months, seen a number of different pieces go by as well. So there is a need for manufacturers and device manufacturers and caregivers to be best and first to market with care as it garners the market. And as everything today goes through the cloud or some version of it, no one can lose sight of the responsibility that's there for security. So to kick this off, what we're going to do is we're going to ask a question of you, if you don't mind. If you are in one of these 4 segments of the healthcare profession, whether it's being a device manufacturer, whether you're a delivery organization like a hospital, whether you do medical records, or if you're the insurance and payment segment, if you could go ahead, they're going to push this poll out right now and ask you to answer that. And if you would be so kind, we are going to see what our audience looks like, and I will try to maybe touch on some things accordingly. So please go ahead and push that out and gather the poll results. This is where the Jeopardy music comes in. Okay, so what we see then, is that, 1 second, I'm trying to get to my poll results. Gather poll results. I'm sorry, I'm not seeing the poll results. Could, Tierney, do you see the poll results, please?
Tom, so it looks like it's
Yep.
76.
There we go.
You got it?
Yep. I'm sorry. No, please go ahead.
Okay. 76.5% was medical device manufacturers, 11.8% healthcare delivery organization, and then 11.8 is the payer system.
Perfect. So it looks like it's heavily in the device segment, and that works out absolutely fantastic. So thank you very much. So let's take a look at some of the challenges and costs associated with this. So one of the things, I'm just going to go ahead and build the slide all the way out, if that's okay with everybody. I think one of the things that's most interesting, or one of the things that we found that was interesting from this study, is that healthcare is actually one of the largest segments for attack compared to all other industries. And not surprisingly, I guess, it is a high-value target for bad folks that want to do things. And it is something that is constantly under attack with a really expensive cost per record of incident. And so because of these kind of threats, and we've seen things like entire hospitals shut down for ransomware. You either pay us money or nobody gets their medical records or their services. It has been a true challenge for the healthcare industry to protect itself. And some of that is a line of defense at the wall and phishing attacks and things like that. And some of it is associated with the specific data points. And as this comes forward, we're seeing a change in regulations, and they're really across the board. I kind of want to touch on a couple of things that were really important. As many of you in the device manufacturing field knows, the FDA offered guidance on how to do cybersecurity within new devices that were coming to market. And Keyfactor actually participated in this. I was there at the FDA review meetings, and we actually commented on and are expecting to be included into the final publication that comes to market. And we did that based on the interactions that we have had with our customers and trying to understand that. But it's not just the FDA. We're seeing the federal government become involved, and you'll see, I think, much more of that as they try to produce some standards. We're seeing initiatives by the industries themselves to do some self-policing and to have potentially these SWAT teams or review teams that can look at an event in motion and give recommendations to the market as these things happen. So for all of these reasons, these regulations are coming forward, and in order to get through the approval process, it will be incumbent upon device manufacturers to be able to present their position in cybersecurity, and we're going to talk a little bit more about that in a second as well. One last thing as it relates to that, and I think most of you that are in the security side of the business, whether you are a healthcare delivery organization or not, is the NIST cybersecurity framework. And the reason I bring this up is that the foundation of almost everything that is put forward in terms of cybersecurity starts with identity. It's, do we know exactly what our devices are, and can we identify them appropriately and have them in inventory? And then it moves into that we want to protect those devices. We want to detect when something bad happens. We need to be able to respond to whatever that event is and then recover. But all of it starts with this idea of secure identity and the ability to update a device and move back and forth within that. So with that, we're going to go to another polling event. So if you would be so kind, and again, answer the question, I believe that my organization is actually effective in securing PHI and data, and this is anonymous, so please feel free to say the right thing. Yes, we do. No, we don't, or I'm not sure. And it looks like we'll go ahead and gather that information for poll 2. And we'll give that a couple seconds. I'm going to see if that pops on the screen for me here. Let's go ahead and publish that out. And Tierney, again, I'm not seeing the results, if you could be so kind.
Okay. Yep. So I have 50% says yes, 41.7% says I'm not sure, and then 8.3% says no.
Okay, good. So it is something that has gotten an awful lot of attention, and it's something that by regulation, not just in the United States, but in the EU as well, is garnering a great deal of interest in terms of how we are protecting our member audiences and things like that. So with that, what do we think about, at least from Keyfactor's chair, in terms of moving to a secure state for the devices that we do? And we have what we call our 5 guiding principles. There is a white paper on this at our website. You're welcome to go find that at a later time at keyfactor.com. But we do have a complete write-up on this available. But just to speak about this with you, we look at it a couple of different ways, and you'll remember that cybersecurity framework. The very first thing that we think about from the standpoint now of a device and our ability to help organizations protect it is that every single device needs a unique credential that is non-reputable. What does non-reputable mean? It means that it is a very, very high assurance identity that is actually, and we have defended it in a court of law, based on the ability to secure it with a digital signature and the cryptography that's contained within that digital signature. And device 1, 2, and 3 do not get the same identity. Device 1, device 2, and device 3 all have their own separate identities. And these are very high assurance identities that are capable of withstanding, for the most part, very forced brute attacks. In that case, there is a key that says here is how we protect that identity, and wherever possible, we want to be very protective of that key. And so there are steps inside of the process that allow you to store this key away in multiple layers of defense that allow you to do that. So it's having that digital signature out there. It's protecting the key. Now that you have that, every device, or almost every device, has software and firmware on it. Firmware being the chips, software being the instructions that make those chips work, and lastly, data that's on there as well. For device manufacturers today, because these devices are connected, quite often they want to do updates to those devices rather than doing a warranty recall or doing some other piece. You want to be able to manage those devices that are in the field. And as such, be able to do those updates and do them with a high degree of confidence for each individual device. And that is what digitally signing firmware and software is all about, is this ability to be able to know that, A, I'm speaking to a device that is mine, I know what it is, and I'm very assured that it is. And when I do send something across the wire, I know that it is protected until it gets to that device and can only be accepted by that device if it has the right signature associated with it. And so that becomes very important. Those signatures are provided by something called a root of trust. So if you go into an organization like most of you do and log on to Wi-Fi, the odds are is that your IT department provided you with a digital signature or a digital certificate that's on your laptop or phone or whatever. And when you went to get on the Wi-Fi, you had to authenticate. And you are authenticated to a very specific root of trust that says, if you're not part of this root of trust, you can't get on my Wi-Fi. Same thing for medical devices. And by the way, for a manufacturing company that does that for things that they buy and use inside the facility, they want to be able to do that for the devices that go onto into the wild and are used by individuals. And you know that that specific root of trust is for that which is different than that which you use inside the organization. So that's a very a big deal. And the last piece is that all of this that we talked about in terms of keys and signatures and digital certificates and all these parts and pieces, it is a virtual certainty that the device that you're using or the device that you're manufacturing will outlive the strength of the cryptography that is inherent in all those devices that allows it to do this. There is just something called Moore's Law, which says that compute power goes up exponentially over time, and the ability to crack a or potentially make a weak algorithm, which is that cryptography, over time is something that will happen. And it right now it's rolling in about a 4 to 7 year window whereby that has to be changed. So if in fact you're going to make a device, and I'll say, how about a pacemaker, and we're going to put a pacemaker in your chest, and that pacemaker is supposed to be there for 10 to 11 years, you now have a situation where the device has outlived its ability to be protected by a very good certificate and a very good cryptographic algorithm, and therefore it needs to be updated. The organization needs to be able to reach out to that pacemaker and actually say, I'm going to replace this signature with a different signature, and that signature is going to be a stronger, more high assurance than the last, and I need to update that across my entire inventory. Now, for us, in practical terms, we needed to do a proof point for an automotive manufacturer that said, what we really need to do is update this over tens of millions of automobiles, and we need to verify that we can do this in a reasonable amount of time and that you're capable of doing that. And in fact, that's one of the test points that we had to go through. And if you remember back to the conversation that I had about some of the FDA guidelines that are coming out on cybersecurity, our specific recommendation is that however you choose to do it, or whomever you choose to use to help you with that, cryptography just not only needs to be present on the device, but it actually needs to be updated over time. Because if you don't, you will have a breakdown in the situation, and you need to be able to update that. So those are our 5 guiding principles. Again, there's a piece on the website that you can look to on that. I think it's a decent piece of reading. It won't put you to sleep, but it will give you a little bit more insight in depth into these 5 principles. Okay, so now that you have these principles, let's say I want to actually do this on a device. So for a couple of things that I'm going to do today, I'm going to name off a couple of devices that we work with. But this is true across all devices, and so I'm using them for illustration purposes. And then right after this section, I'm going to talk about 2 real-world scenarios and how this all starts to come together for the device manufacturer, for the caregiver, and for the patient itself. So we now have a situation where we are a modern manufacturer, and we do our manufacturing in China, Vietnam, Eastern Europe, Puerto Rico, Mexico. It matters not, but we are actually running an assembly line where we're building pacemakers, or at least we're building a chipset or some guts that will go into the pacemaker itself, and then maybe we ship those internal pieces off somewhere else in the world to be assembled into a device, and then we take that device and actually move it to the customer itself, activate that device, and provision it so that we know that it's out there and we know the individual that's using it, we know what it's being used for. And then, as I said before, over the life of this device, we may want to update it, give it some new instructions, or we may want to update that cryptography that I talked about that may come to end of life. There's a number of reasons why we want to be able to know exactly where that device is, what its status is, and what its capabilities are. So in the first step, we actually have the ability to install some of this cryptographic signature at the time of manufacture. So today's modern chipsets allow you to be able to generate very securely in a manufacturer location globally this provisional identity onto the device. And with that provision, we can find out some other information. There are things that are on those chipsets that help give you a little bit more robust information, like a serial number or some identifying number or a MAC ID or something that says, hey, this unique digital certificate is associated with this specific chip, And because that specific chip goes back into some sort of an ERP or inventory or customer-based system, you can now start to bind things together and get robust information about the device that you're actually manufacturing. So we can provide that trusted bootstrap certificate onto that device at manufacturing, and then that may go directly to a patient. It could sit on the shelf for some period of time, but it has a known identity associated specifically to that device that allows it to come online with a high degree of confidence. So at the point now that this is now implanted or associated with a specific device, we've got the ability to have it connect, and when it connects, it's going to come back to a system that is in the manufacturing facility or in the master company, and they are going to be able to swap out that unique identity at provisioning for one that's going to put it into production. And you'll see some things up on there about on-device key generation. That's what ODKG means, or a CSR, and different formats that it can be done in. But certainly, we have the ability then to provision to that a permanent certificate, and again, update the business systems. And perhaps in a situation you can say the device is now active, or it's entered a warranty period, or please notify someone in customer service to give this person a call because. And so all of these things that allow this unique digital identity, remember this identity is providing that unique authentication, it's providing encryption of data, it's allowing you to have secure updates, all of those things. It is now provisioned and activated not only by the software, but also by the business systems that are associated in the organization. Now that that device is online, what did we say we need to do in order to assure security over the long term? We need to put it in inventory. We need to be able perhaps to re-enroll a certificate, add or remove things, do those software or firmware updates, do the data encryption for PHI or other cases, and we want to be able to bind that all together and over a long period of time and be able to update that. That's what continuous management is all about. And in our world of doing that, because we can do that in and out, we talk about crypto agility. And crypto agility really is being able to go back to that device and make sure that it has a strong method of authentication. And if, in fact, something has changed, whether something nefarious happened inside the organization and you have to swap out all the IDs because someone did a breach at the organization, or over time, if that cryptography has become weakened just by age and compute power and a number of other things, this ability to be able to do this over the lifetime is very, very important. And for those of you that are up to date in certain pieces of technology, quantum computing, which is over the horizon for in somewhere to 4, 6, 8, 10 years, is coming, and the industry as a whole believes that when it does come, it is going to put into serious jeopardy all of the past security methods that have been used. And we, along with a number of partners that we work with in the industry, are already looking at what does it mean in a post-quantum world to be able to provision an identity that keeps this high level of security up. Do we have the exact answer today? No, we don't. But I am confident that the industry and Keyfactor will have the right answers at the right time and be able to do that. Again, the intent of that is to be able to have a device do exactly what it was designed to do without interference over the lifetime of that device. It's a big deal. Okay, I'm going to switch gears a little bit, and I'm going to talk about a couple of use cases, show you a little bit more behind the scenes, and then open it up to questions. But first, we are going to go to poll question 3, and this is the last poll question, and it is, I believe that healthcare is going to be delivered more remotely through personal devices like phones, whether they're iPhones or Android or some yet to be named, tablets, watches, Fitbits, other wearables. And do you believe that's true? And I trust that the device that I mentioned above is secure, like the iPhone or tablet or watch. True, but I don't trust that device. Or no, I didn't think of that as an option. So why don't you go ahead and do that? And again, I'll ask Tierney to gather those results, publish them appropriately, and give them on back to me.
All right, Tom, so I have 37.5% say true, I trust that device is secured, and then 62.5% say true, I don't trust that device is secured.
Interesting, and not surprising. That's a great answer. Thank you very much. Okay, so this is going to lead me into, I'm going to give you a couple of examples, and then I'm going to take you into the actual case study of one of them just a little bit deeper. But let me give you a couple of examples that I know for a fact are true today. So childhood diabetes. There are things called continuous glucose monitors, and what they do is for people at risk, you can wear something that is checking your blood sugar constantly. And based on the state of blood sugar, it can, in association with an insulin pump that's also wearable, be able to provide regulation in that blood sugar and keep folks from going into shock or coma associated with their disease. And so if someone accidentally gets too high or too low, it can be taken care of appropriately. So if this happens to your child or your significant other, and you would like to be aware of that as a parent or a loved one, then perhaps you'd like an application on your phone that you can say at any point in time, I can see the blood sugar, the continuous glucose monitoring, I can see that on my phone, and I know the state at which my child is at right now, and that gives me a lot of confidence that I'm not looking at a medical emergency that would otherwise be relegated to the playground, the schoolroom, the school nurse, all good folks, but really is giving you real-time information to do those kind of things. In order to do that, you need to have a few things in place. You need to have a device that is connected, whether it's connected over a Wi-Fi connection or whether it's connected to potentially a cell phone. So all of us have Bluetooth earplugs, right, for our iPhones and Androids, or we want them. And so if that device is actually sending out a Bluetooth signal to that phone then can in turn transmit that over Wi-Fi or an open air channel to some sort of a collection point. That collection point can push it to a back-end system. The back-end system can be connected to a caregiver, could be connected to an emergency number, could be connected to you as an individual. And based on all of that, information is potentially going back and forth. And indeed, based on what's going on, a caregiver might say, do something different. So it would actually send information back that might say, administer more, administer less, do something different than's happening right now because we have a critical situation. So what we did was we said from the device itself, which is connected to a human body, it went through a phone, over the air, through into the cloud, into some sort of a hub, whether it's an Azure or an Amazon Web Services IoT hub, transmitted back to a facility and a caregiver. If you have the cryptographic signature that's actually appropriate for that situation, we know that the device itself can take and be uniquely identified. So as it's reaching out, someone can't identify that device that doesn't have the key to it. And that the data coming from that is actually encrypted at the device level. And so when it gets to the phone, can't be tampered with. When it gets over the air, can't be tampered with because you can't see it. When it gets to the IoT hub in the cloud, can't tamper. It's still encrypted. Until it goes to the back-end system, this encryption methodology and the only two people that have the key, which is the device itself and the back-end system, all of that information remains secure and is not vulnerable to attack during that process. And thus, as you look at what we're seeing in the market today, what we're seeing is a number of devices that are being controlled, or their communication vehicle is an everyday device, a phone, an iPad, something else, that is communicating over a common medium and going back with critical information. And as I said before, perhaps we're sending information forward from a back-end system that says, I want you to change these settings, change the number 5 to the number 7. That's simple. What you want to be able to do is when you send that through that whole system backwards again, you want to be able to encrypt that or sign that data packet that says move from 5 to 7, and only when it gets to the device, and only if that device has the proper key, can it actually be told to do what it needs to do. This is reality. This is what people are looking at and doing today. We see it a lot in the current generation, or the next generation of devices that are very much outside of the control of the hospital. If you're in the hospital and you're using something that's in a hospital room, you want the same measures of security, but it's a little easier if you control the network and you control the 4 walls and you control the access and things like that. Once you're out in the wild being at home, at school, at work, on the playground, it's a different story. And there's other ways that bad actors can try to go through the security that's present. And our ability, along with our customers, or our customers who are truly designing this type of safeguard and this type of usage we're assisting them in making this a reality in terms of coming to market. So that's one example, and the other one that I used earlier and that I'd use again is a pacemaker, and it fundamentally works the same way. It is in your chest doing exactly what it's supposed to do. It was manufactured, a couple, 2-3 years ago, and they found a way to extend the battery life, because the other thing about pacemakers is if you change the batteries, it's a little hard. They have to do surgery. So they came up with a new way to extend battery life by updating either the firmware or the software on a given platform. And so to be able to change those types of things, again, you've got to be able to talk to it and be able to send something with a high degree of assurance that can be done. Same thing with the monitoring of the information. The data has to be authentic by regulation. Any personal health information has to be encrypted and secured. All of these things go through the process. And so you can repeat this type of scenario over and over again across a multitude of different things that are out there. And the number of things is growing like crazy. And the ability to use those is something that continues to come under inspection, review, regulations, compliance, and all of those things are what we try to help our customers with. Just a couple of back-end slides, and I've kind of already referred to all of this, but we have some software and a platform in the back end that works on this, and we work in conjunction with other partners that keep things safe, like Gemalto. And we can issue those credentials out into the general world, into an operational back end, so that from an operational standpoint, you as the manufacturer can produce a product and communicate with that product with confidence. It can go through that big hub in the sky that we talked about, and to the specific device, whether it was inside of a hospital or otherwise. A couple other interesting scenarios, not attached to your body ones, but hospitals, especially things like surgical rooms, don't like to have connectivity full-time to those devices. Why? If somebody in the middle of this says, oh, we're going to do a software update in the middle of heart surgery, that's a really bad idea. They don't want to reboot that device. And so you see this concept inside of healthcare delivery organizations of controllers. So everything that we just said about going to the very specific end device, in some cases we actually go to an intermediary device called a controller, and that controller is able to communicate with the device at a time and a maintenance window that is specified and agreed upon between the manufacturer and the healthcare delivery organization so that nothing is interrupted. Again, thinking about all the processes and all the things that go on, trying to build that in layers so they can be defensible. And same kind of thing, we talked about data encryption and how it goes through, making sure that the firmware is trusted against that root of manufacture for that specific manufacturer, and that we're moving things through the system very securely and very protected. And that's kind of what we do for a living, is we help folks go through that and figure out how to make that happen. Every scenario is a little bit different in the way that things are designed and how they're used. The use cases tend to vary. The principles of security tend to stay the same, so it's a matter of understanding how an organization builds those and how they work through it in terms of software and production and all those parts and pieces, and in working with them, coming up with a scenario that increases the odds of security being at the very, very top of the game. So with that, I've been speaking for about 40 minutes. I would love to answer some questions if you have them. My email address is here as well as my phone number. If, in fact, you have a question that you would like to ask me directly, I encourage you to reach out and do so. We'd love to hear from you. Also, you'll see our website, keyfactor.com. All of the information, about 98% of what I told you, is out on the website and is available for you to see. We do, try to keep our customers' identity confidential. We do list some of the folks that we work with, but the specific scenarios are confidential because because we do work in security, and we would not disclose any trade secrets or other things that might be a benefit to folks that would do bad things. But we would, under NDA, be glad to go a little bit deeper in how these things actually transpire and give you the details on that. So with that, guys, I'm going to open it up to questions and see what we want to do. So who wants to ask me? Tierney, you want to do this?
Yep. So we're going to move into the taking questions based on the webinar. So I'd just like to remind everyone and encourage everyone to submit questions at any time just by typing into the space provided on the screen. So one of the first questions was, what strategies are organizations using to expedite the approval process from a security perspective to getting IoT devices onto the network?
Oh, that's a good question. So there's a couple things that you should consider as an organization, a couple of best practices that we've seen. Almost, whether you're a healthcare delivery organization or you are a manufacturer itself, there is almost always a global security office. And that global security office understands the underlying technology that we're talking about that allows for the provisioning of this. And there becomes this partnership between the device manufacturer, the global security office, which manages those standards, and the intended use case, where it's being connected, whether it's inside or outside of the hospital, so on and so forth. And additionally, in the manufacturers, we tend to see an office of product security. So besides the idea of a global standard for security, there's product line standard for security. And the organizations mostly have grown through acquisitions, so you'll see a cardiac unit, and you'll see a neurology unit, and a diabetes unit, and so on and so forth. And because of that, what happens is that those divisions usually work through the product office in association with the global security team, and work together. So the way to, the way to expedite the process. I'm going to take a sip of water. Thank you. The way to expedite that process is to kind of get all of those in unison. The actual development of this is rather quick. The lead time to market for devices is probably no less than 9 months and no more than 15 months. But we've entered the process a little bit late, and we believe that at least as far as getting cryptography on the devices, making it updatable and all this, we can enter the process fairly late and still get there maybe within the last 6 to 7 months. But if you look at the process of how you have to go through regulatory approval, the second half of that is being able to show compliance because you have all these pieces under control and you can get to the regulatory process and demonstrate not only do you have the security model integrates with your inventory or ERP model, which integrates with, a couple other things. It allows you to lay it over your security plan, which is probably based on the NIST cybersecurity framework. This idea of not only provisioning security, but having control over it is probably what will get you through the process fastest.
Perfect. So the next question is, where is Keyfactor most effective in integrating with the product development cycle of a medical device?
That's a great question. Again, another great question. So two things. First, there is the business side, and then there's the engineering side. So there is the diabetes team, which is setting the business's path towards new care and new devices based on what they believe is relevant in the market. And we can help there from the standpoint of being able to lay a foundation and say what you want to be able to do is doable in a highly secure manner. The implementation of the solution is actually at the engineering team. So I would be honest and tell you that once everybody agrees that that's the right thing to do, we actually need to talk to the product engineering team because they are attempting through the tools that they have and the knowledge that they have to build this into the product. They're not naive. They know they have to do it. What I think we actually do, and what I think our customers would tell you that we do, is we give them the easy button. Rather than them trying to have to figure out a security model, where they're going to provision it, how they're going to support it over its lifetime, all these types of things, what we wind up doing is, because we know the global security team and their standards, we give them, the engineering team, something within the global security officer standards that they can quickly and easily fit into their product build. So one is the belief that the security model is correct for the product overall, and secondly is the engineering and the design into it to make it become a reality.
Awesome. So someone asked, can this process also work on existing or current inventory?
It can. So I mentioned at manufacturing, but we've got a number of customers that are between generation 1 and generation 2 devices. And they need to up their game because the market tends to be a dangerous place. It's extremely doable. I would guess that the existing device is not using the Android, iPhone. There may be a custom controller. They may be doing it by hand. We actually still see where a technician goes out there. The single most important thing is that once identity, a digital certificate, the cryptography is provisioned to the device, you're in a very good spot. You can now be assured that the communication is secure, going back and forth, the identity, all the things we talked about. However, how assured were you that when you provisioned that identity for the first time, that it was actually asked for and given to an authentic device? When we're on the assembly line, because of something called on-device key generation and some things we can do, there's a high degree of assurance that nobody can mess with that cryptography at manufacture. Easy to, you can get a tight control on it. For a device that's out in the wild, we actually have to work with the customer to say, okay, how are we going to know that when we open this up and say, go put this here, that the request we got was absolutely as authentic as it could possibly be, and when we were provisioning that identity to that device, that we know that it wasn't interfered with along that path. It's quite honestly a little bit more complicated. It's not awful, but it does take a different level of diligence to make sure that you're doing that, because again, if we provisioned that information to a bad actor, they now have a set of keys that may undo all of the good things we do on 100 devices. So one bad actor on 100 devices, one bad actor gets through, does that jeopardize the rest of the chain? And so we spend a lot of time talking about the assurance of provisioning that identity and the quality in which that identity is provisioned the first time.
Perfect. And then due to time constraints, this is going to be our last question. So what do you do when separate divisions of our company have separate design groups in different locations?
Great question. So we run into that almost everywhere. And so what we've seen as best practice is that the organization, so company A at the very highest level, has control over this root of trust, this place where everything comes from. And then you actually wind up making subsets. So you've got A1, A2, A3, A4, and A5. And A1 will be the cardio division. And if something happens inside of the cardio division, you just have to replace the cardio division. But it all ties back to the master, the big A. And if the neurology division is A2, then A2 has its own path by which that they can do this. They can do their own programming in their own environments, but it all ties back to A. And so the master company controls, has some control. They can provision out to the divisions their unique sets. The divisions can then put them into their product. So if a pacemaker gets compromised, it doesn't necessarily mean that you got to do something with the diabetes pumps. It's actually extremely common that the manufacturers today, especially the big ones, are a conglomeration of companies and divisions that they purchase separately, and it's actually a very elegant way to do it. They get their own development environments and everything else where they get to do their own work and build their own processes.
Great. And that concludes our webinar for today. So thank you everyone for attending today's webinar. A special thanks to Tom Klein and to our sponsor Keyfactor. Look out for an email with a link to access this webinar on demand within the next couple of days. And then as always, have a great day everyone.